All right. Hello, everybody. My name is Caitlin Malay, and I'm the lead for the dance medicine program here in our Walnut Creek campus. And our presentation tonight is Stay Strong and Dance On. So we're going to talk about common injuries, injury prevention, and then jump technique in the young dancer, along with some of the exercises that you can do and some really cool things that you should keep in your handy-dandy dance bag. Okay. So the first thing we're going to talk about is some of the causes of dance injuries. Some of them can be trauma from falling or twisting, kind of landing wrong or colliding with another dancer. Technique issues or training errors, so not giving your body enough time to rest in between a hard class or doing too many dance, too many classes during the week. And then overuse injuries actually account for 40 to 50% of all dance injuries. So that means doing too much dancing either at once or too many classes and not doing any other types of activities, especially to unweight your body, like swimming is a really great example of things to do, especially for our young kids who really start doing a lot of dancing or a specific sport at a young age, that they can get a lot of overuse injuries from not doing any other types of activities and kind of specializing just in that one area. And then we have poor self-care, so not eating well, not eating the right foods, not sleeping enough, or not drinking enough water and becoming dehydrated, especially when you're rehearsing or as your rehearsal hours start increasing during your fall performances. And so the vast majority of dance injuries or problems don't require surgery, which is really great, but they do require some rest, dedicated exercise, and commitment to prevention so you don't get hurt in the first place. Location of dance injuries, so unfortunately they're very, very common. So we see at our clinic here in Oakland, San Ramon, and San Francisco, we see a lot of dance injuries, especially in our young athletes and our young kids. So 65 to 80% of those injuries actually occur in the legs. So from the hips, knees, ankles, feet, and toes. 10 to 20% are in the spine, with over a majority of 50% being in the low back, which is very common, especially for our young ladies. And then 5 to 15 are in the arms, more specifically with our males. Here's some photos of dance. Back pain. So we're going to talk a little bit about each of the specific areas that our dancers can get pain, and then we'll move specifically over to Heather, who's going to talk about when you're actually a little too flexible or when you push too hard into a stretch. So back pain is very common in a lot of our young people. And for our dancers, sometimes it can be a strain or a pulling sensation that they get in their back. Or we can get some other bad things like spine fracture, which there's my picture, which is an overstress of the low back or one of the spinal segments. Usually for a lot of our young dancers, it is in the low back. And it's from just a lot of hyperextension, so leaning backwards a lot during MFS or during your warm-ups at the bar. And then muscle imbalance. So some of our muscles can be very tight and some of them can be very weak. And then hyperlordosis. Hyperlordosis means that you're standing with an increased arch in your low back. And then as you go to, let's say, extend backwards, there's not enough, let me go back. You're already in a very arched position, so your low back is already getting compressed. And then when you go back to extend further, you get a lot of wear and tear on the actual spinal bones in your back, to which can lead to this stress fracture or this overuse fracture in the low back. And basically, with that, what can happen is we just get a lot of kind of breakdown or stress in that one little area, and then that actual area of the spine will kind of fracture a little bit. And then we either have physical therapy, or if it's really bad, then you actually go into a brace. So we don't want to get that far. So that's why you all are here. And then we have hip pain. Okay. So there's different types of hip. Hi guys, come on in. So there's different types of hip pain that our dancers can get. The first one is a hip flexor injury. So the hip flexor is a muscle that attaches to your low back and then it attaches to the front of your hip. And so if it's very tight, it can pull you into that overarched back position. And what we see with a lot of these young girls or boys is that they have really tight hip flexors and then their tummy is really weak. And so when they're doing a lot of their kicks, instead of lifting from part of their lower leg or the back of the leg, they really lift from their hip flexor, and that can cause a lot of pain in the front of the hip, such with kicking or lifting the leg. Then we have snapping hip. So snapping hip is when you are doing a kick or a lift to your leg, and sometimes you'll feel a pop. Sometimes it'll be a pop or a click or a clunk in the front of your hip, or sometimes in the side. So if it's on the side of your hip, if you look at picture number 1 that has the red line to it, that's common to be called your iliotibial band, which is a really thick structure along the side of your leg. Or it can be something called your TFL, your tensor fascia lata. That's a muscle that's on the front of your hip that helps with bringing your leg out and bringing your leg up. So sometimes you can get some of that pain and clicking along the side of your leg. The other one is pain on the front of your hip, like in picture number 2 with the purple line that's cutting across the hip. And that can be with a lot of kicking forward or kicking up and out, and sometimes the dancers will feel a clicking in the front of their hip, and that is that hip flexor really tight rolling over the actual hip bone. And then the easiest way that we fix that is by some stretching, and usually some deep massage. Snapping hip is really common if we're actually sinking into our hip instead of standing up and nice and tall, or overusing certain muscles like that hip flexor in the front, or poor turnout. Okay. Patellofemoral knee pain. So this is pain in the front of the knee. So the patella is actually your kneecap, and this is just general pain in the front of your knee that a lot of dancers can feel, especially underneath the kneecap, or sometimes it kind of circles underneath like a little smiley face. So this can be very common with a poor turnout. So if they're actually over turning out their feet, and then when they go do their pliés aren't tracking over their second toe. And so their knees are kind of falling inward, and that can cause a lot of discomfort, especially on the inside of the knee. Muscle imbalance. So we see this a lot as well if you're really tight in the front of your leg and your quadriceps and your bottom muscles, or the muscles that help with your turnout, they're called our external rotators, or muscles on the side of your hip abductors aren't very strong, and so you get a lot of wear and tear under your knee. The dance surface, if the surface is too hard, and then that decreased strength in the hip, tight hamstrings, so the muscles on the back, and poor landing. So if you look at this dancer right here, this is better technique, and here you can kind of see her knee falling in over her big toe, or even actually straight up over the ground, where she should be having the middle of her kneecap facing her second, third toe. So if we're falling in when we're landing, we can get a lot of pain under the kneecap as well. And here is another example of doing a grand plie with the girl in number H. Her knees, as she's going down, is tracking over that second toe, where this young lady here, her feet are really falling in as well. We call that pronation. And then her knee is tracking really far forward. So when our knee kind of falls in and forward, the kneecap can rub on the bottom of the knee joint. And then we go to foot and ankle. So we can see a lot of ankle sprains, so landing incorrectly. Ankle sprains is a sprain is basically when you injure your ligament in your ankle. And when you injure a ligament in your ankle, you're not going to feel as strong. You're not going to have proprioception. Proprioception is where your body is in space. So you might stand or land incorrectly and think your foot's in one area where it's actually kind of in another. Fatigue can happen a lot because you've injured that area, so your muscles need to be very strong. Poor technique can lead to this, or slippery floors. And then we have strains. A strain is an injury to a tendon that attaches to a muscle. And so we see a lot of ankle strains, usually along the front of the actual ankle, so you get a lot of pain kind of on the inside of the foot. And a lot of it is from either turning out too far or letting your feet pronate or fall in. So your arches are collapsing, so your feet is very flat. What that does is it actually pulls on a tendon that we have right here on the bottom of our foot, and the muscle attaches to the side of your leg. Hello, I see you. So you can get a lot of pulling and tension along the inside of your leg, and then you start developing this pain kind of right in the middle of your arch. So we really want to make sure that we have a really nice arch when we're doing our pliés and we're landing from our jumps. And then Achilles tendonitis. So an itis means we have inflammation. And the Achilles is a tendon that connects both of our calf muscles together, and it attaches right at our heel, right down in here. And so sometimes we can get an inflammation, or the tendon gets very angry, and This can be due to rolling in of the foot, or when we're coming up onto our toes in a releve, our ankle actually sickles. And then a tight calf or heel cord. So you have to really make sure with how much time you go up onto your toes that you really stretch out your calves. And then kind of a gross one with feet. Bunions, neuromas, corns, calluses, and hammer toes. I looked up a lot of photos earlier of corns and calluses, and it was kind of gross. But it is very common in all of our dancers. So when you have foot injuries, the biggest thing is to wear proper footwear and then pad the area appropriately, especially when you have some corns or blood blisters. It's really important to make sure that those heal well and they don't get infected. Bunions is an increase kind of in growth on some of the bone along your big toe, and then it actually moves your big toe, kind of falls in a little bit. So instead of your big toe tracking forward, it curves in. And that's going to change how you go up onto your toes or how you're landing from jump. Plantar fascia is on the bottom of your foot. So some of our dancers will roll the bottom of their foot out because that calf muscle in the back, if it's really tight, it kind of connects to that plantar fascia. So we can get really tight in there. And if your feet are falling in, so if your arches are falling when you're doing a plie, it can get really tight as well. So you need to make sure that stays very loose. And that can be from the poor turnout, forcing through your feet, or tight heels and heel cords. And then last but not least are stress fractures, which can happen along the first or fifth toe. And that can be just from landing too hard or not quite being strong or overuse. And so you end up fracturing your foot. And now I'm going to go hand it off to Miss Heather.
Just which one is it?
It's that one.
Okay, the hypermobile dancer. This is a big problem in dance, as we know. Sorry. So what is it? Hypermobility is when you have a joint that has above the normal range of motion. Okay, is this an asset or a liability? Most dancers will say it's an asset, right, to have more flexibility, and if you have more range of motion to do things that you want to do, the arabesques and things like that. However, it can become a liability if you are overstretching and you're starting to get pain into your joints and in the tendons, and like Caitlin, all those injuries that Caitlin was kind of going over there. So, you know, some people are just born with it. They have that laxity, and some people acquire it by overstretching. So some of the causes that can cause the hypermobility is the bone shape. Everyone's bones are shaped a little bit differently. And if your bone, depending on how it sits in the joint, can create more hypermobility than other joints. The collagen, you make up of your collagen, you could then cause your tendons and ligaments to be a little bit more lax than normal. And then strength is a big one. So you'll find that the dancers who have hypermobility that have learned to strengthen properly will not necessarily have problems with hypermobility. They have the flexibility to do things they want to do, but they still don't injure themselves because they have the strength surrounding the joint. But those who don't develop their strength properly then get into problems, and that's where they can be diagnosed with a hypermobility syndrome. Impaired proprioception, like Caitlin was saying, where your body is in space, not knowing how to line up the joint properly, that can lead to a problem. And then hormonal factors. Young ladies, as their bodies are changing and the hormones start to kick in, that can create more laxity within your joint as well. There's one, well not one, but there's one nice assessment out there is the Beighton scoring scale. Have you guys heard of this one at all? Okay, so it basically is out of 9 points, and it goes over 5 different points over the body. I don't have the hypermobility, but I'll just demonstrate. You're looking at your 5th digit. If you were to pull it back, this is a 90-degree angle here. If I can go further back, I would score a point. Oh, there you go. I should have you demonstrate.
I have like tremendously.
Yes. Yeah. So she would get a point for each hand. Okay. Then you would look at, can you bring your thumb to your forearm? I bet you can do that as well. And if you can do that, then you score another point on each hand. Then you look at your elbow mobility. I have a little bit of hyperextension, but if it's greater than 10 degrees, which you can measure with a goniometer that physical therapists use, that would be another point on each side. And then you would look at knee hyperextension. I have a little bit, but I don't have greater than 10. Again, another point, and then if I was able to touch my palms to the floor without bending my knees, I would get another point. So anyone who scores higher than 6 out of 9 is considered hypermobile. If you're someone who scores higher than 6 out of 9, plus you have at least 3 months of pain in a joint, then you're typically diagnosed with a hypermobility joint syndrome. Okay, so common issues with hypermobility. We talked about proprioception, knowing where your body is in space. Somebody who has more laxity in their joints may push this to the limit, and then they end up with an injury. When you do this, it also tends to lead to poor posture, decreased balance, and poor coordination. Okay? Then dancers may also see biological changes. So their skin may look different over that joint. And if you were to go deeper into your tissues, you would see the joint capsule, the ligaments look a little bit different than non-hypermobile joints. Okay, so what can you do? Okay, because it's all great, we know we have it or we don't have it. What can we do? Please don't do that stretch, that is not good. Okay, proper alignment, starting to learn how is my joint supposed to move? What is it supposed to look like? You know, listen to your instructors. If they're telling you you're not in the right position, you really need to pay attention to that. One focal point is always the pelvis. Okay, so if your pelvis is in a good spot, that does help line up the rest of the chain, which will help you with your knee and your ankle. If your pelvis is not in a good spot, then everything else changes below and even up top. Okay, so that can make a big difference. Strength training, like I've said before, work on strengthening in the proper position of that joint, very important. And core strengthening, kind of go together. Find the deep stabilizers of those joints and really strengthen those. I know a lot of dancers are starting to do Pilates or have been doing Pilates, which is wonderful. It's a great way to work on core, and if the core, like I said, if the core is in a good position, then the rest of the chain tends to line up well, like the hips and the knees. Proprioceptive retraining, because you can be strong but still don't have good joint awareness, so it's just as important to retrain that. And then this is one thing people forget, nutrition. So as you're strengthening the muscle, you need to be feeding it proper nutrition so that it can get stronger. But at the same time, if you have an injury, the tissues aren't going to heal as well if you don't have that proper nutrition. Okay? And then setting up a proper dance routine. So the hypermobile dancer needs to maybe have a longer warm-up. Since their proprioceptive system is a little bit slower, they might need more time to kind of get everything ready before they start to dance. And then not overstretching. It's very important. I know a lot of dancers say they feel tight and they need to stretch. As you can see, as this girl probably feels tight, so she feels like she needs to do this stretch. But using tools like the foam roller to roll out where you feel is tight in a normal joint position and releasing adhesions is a great way to kind of loosen it up without going to the end ranges of these positions. And then also trying to avoid popping and cracking of joints. I know you can see a lot of that. You know, it's just hard on the joints for long-term wear and tear. Plus, you're just overstretching ligaments and the capsule around it instead of working on strengthening. Okay. Okay. So she's not here yet.
So Danielle isn't here yet. I'm guessing she's still stuck in traffic. So she, when she gets here, is going to be talking about the anatomy of a dancer's jump, which is like the. Is she here? Dun, dun, dun! Perfect timing.
That's perfect timing.
Literally running in the door. And then as soon as she walks in, yay! She's going to be talking about the anatomy of the dancer's jump, and then we're going to go a little bit back and forth between her PowerPoint and then some videos that she has. So we'll be able to bring those up as she goes. And then we'll talk about some exercises and foam roll, and I highly suggest if you're here, or even if you're at home, to try the exercises with us. Thumbs up. Okay, so Danielle, why don't you kind of start, and then I can like exit out, and because I have to pull up your videos. Some of them are kind of grainy, but I already have them loaded. So oh, great. Okay.
All right, so we're here to talk about the anatomy of a dancer's jump. In my experience with treating dancers, I have noticed that there's a lot of points in a jump that could contribute to injury, especially in the foot and the knee and the hip. So we'll probably focus a little bit more on that, but we are going to start with your overall alignment, which is incredibly important to start out with. So If you were to look sideways in the mirror, you want to make sure that your ear goes right over the shoulder, over your hip, your knee, and your ankle. It should all line up perfectly. If you're on point or demi point, it should go right over the ball of your foot. If you're shifted any way, like this person is, she has her rib cage out, she's in a tilt in her pelvis, so you could imagine that she's probably going to complain of some back pain eventually, more than likely. And I don't even know what's going on down here. She could be hyperextending her knees, which could contribute to knee pain, all that sort of stuff. This is a great lineup. That's what our goal is. So next time you go into a dance studio, I want you to stand up there and just go to your side and see, how are you lining up? And go into a first position. How are you lining up in first position? Okay? We're going to continue from the side. This is actually only looking from, if we were to change your position of your head, where do you hold your head? How is that going to change the rest of how your entire body is held? Simple change could make such a big difference. So if we're looking up, what happens? We start arching our back, maybe we lift this up a little bit. Maybe we'll lift our rib cage up a little bit. What if we're jutting out like this, which is how we usually sit sometimes when we're trying to get closer to the computer or looking down at our phones? What happens to our shoulder blades? They come forward. How are we going to get up into a nice high position that way? It's going to be tough, right? And then look at what happens here. It's really curved. How are we going to do a cumbre? Backwards. Again, it's going to be pretty tough. So if you can even change one part of your body to make it line up better, you're going to make everything more efficient and also decrease the chance of you having any injuries. Okay, from the front, also important, our shoulders. How many times does your dance teacher say, keep your shoulders down, shoulders out of your ears, right? All the time. So it is really important. Here, she's also creating a lot of tension up here. So maybe, you know, when someone is jumping and they try to have their shoulders help them jump up, this is what happens. If that happens, then we get a whole bunch of movement in your trunk, which means we're probably going to get a lot of instability at either the ankle or at the knee, especially in landing, because we have all that extra motion to control if there's a lot of movement going on in the trunk. So we also want to look at how we're standing on our foot. This is the ideal way to stand on our foot. This is actually really, really important, and you can use it in any position in dance. You want one third of your weight on your first knuckle, 1/3 of your weight on your fifth knuckle, 1/3 in the middle of your heel. And if you can equally distribute your weight between all of that, you're going to find that your weight will hit right in the front of your ankle. If you can do that, that will line you up really nicely. So I'm going to take my sweater off so you can see this, because it's actually pretty simple when you look at it. So from the side, if I take my weight and I put it forward, what happens to my body? Do you notice something? I'm arching my back. What else is happening? Someone else point something else that happens when I go to the front of my toes.
Your hips are forward.
Yeah. And then if I go all the way to my heels, what happens here?
Your back.
I'm rounding my shoulders. I'm actually probably putting a different type of strain on my hips because I'm tilting them the other way, right? But if we can find that spot in the middle, it's so much easier to stack my whole body on top of it. If I had all my weight on my toes, and then I thought, oh shoot, I need to fix my hips, and I try to change my hips in the mirror and the rest of my body, it's a lot of work. But if you get your weight starting out at your feet and then work your way up, it's much easier to find that nice neutral alignment. And again, like I said, that can work really nicely in every single position. So sometimes if it feels like maybe you're getting some neck pain or some strain up here, or maybe some low back pain, maybe just finding out how you're standing is a good place for you to start to see if you can fix that. This is the other thing that we're going to talk about, and we're going to come back to the alignment of how our feet are. I'm sure you also hear lift your arches, possibly. No, that's great. Hopefully that means that you already have this figured out. But sometimes when people are feeling a little bit unstable in their hips, they lift their arch too much and they stand on the outside of their foot. I more likely see in dancers this position, where the arch is completely on the ground. And you know what happens is you try to force that turnout, one of the reasons, and the entire arch just drops because you're trying to get as much motion as you can. Unfortunately, oops, did I do that? Maybe.
I might have done it, sorry.
That puts you at a lot of risk for tendinitis, ankle sprains, other impingement issues in your foot. So it's really important not to give away the structure of your foot for any type of form. If they're saying, oh, you need to get to 180 degrees turnout, and structurally you can't do it, do not force your feet to do it for you, because you're going to need those for the rest of your life. Okay. Doesn't it feel like this is what I just told you? That is what we all have to think about all the time when we're dancing. But if you're stacked up really nicely, you don't have to think about all those differences. If we have our weight on the right part of our foot and we're standing tall through our neck and we're using our muscles appropriately, that's a second thought. Okay? Here's another example, perfect example of when we're in first position dumping our arches. And that's keeping a nice neutral arch. Okay, so now we get to go to the plie, which is the beginning and the end of our jump. So it's a very important part of it. There's a reason why you do so many plies in the beginning of class. So let's talk about the most important components of the plie. We already talked about how we set our bodies up, so we know that. What we want to do, and I highlighted the most important parts, is lifting through your spine, but you want to have an oppositional movement. So while your spine is being lifted, that sacrum wants to be pretty heavy. So you want to pull down into the ground. The next thing you want to do is you really want to get your hamstrings kicking in. Do we all know where our hamstrings are? Yes. Point your hamstrings. Perfect. So if we can pull through there, that's actually going to give us a lot of elongation through the rest of our body. It's also going to make it so we don't shift to our toes, which we all learned what that does to our back and our necks. If we shift our weight to our toes, it allows us to keep a little bit of strength in our weight in our heels. It also helps us get our glutes engaged, which is really helpful in maintaining that turnout. So, which brings us to this, yes. Engage your deep hip external rotators, maintaining our neutral arch that we just talked about. I like to think about whenever I plie or do a squat, is I lift from the arch, I take that energy straight up to my knee, and I take it all the way up to my hip rotators. And if you can connect that entire line up, you don't have to fix anything else, and you're completely connected. So start thinking about that every time you take off and land from a jump, or even just when you do your plies, and you're going to find that it's a lot easier to control the full motion. Next important thing, and we're going to come back to this with landing from our jumps. We don't want our heels to come off the ground when we're doing a demi-plie. When we land from our jumps, we don't want our heels to come off the ground. What does that mean? Where is there a weight if our heels are coming off the ground? Too far forward, in our toes. So, of course, and I'm sure you hear this all the time, ensure that your knees are able to point in the direction of your second toe during the entire duration of the plie. So if we're trying to force our turnout and we're just looking at our feet and we're like, okay, 180 degrees, that's what I'm going to get, perfect. And then we go into the plie and our hips won't let us do that and we're diving in. Where do you think the strain is going to go? Right here, right in our hip. Our knee. And then you're going to come into your doctor and say, my knee hurts. I don't know why. Every single time I go to dance class. That's probably why. Okay, so now the releve. We're getting closer to our jump. So this is going to come back to that first, what I was talking to in this slide where I wanted you to start by lifting your arch, connecting up the rest of your body. So if we go to this one, that's how we're starting our releve now. Starting it from your arch, lift, 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 keep your knees straight. We don't want it hyperextended. And actually there's probably a little bit of discrepancy on hyperextension in dancers, but it is best to be able to control your knee in neutral and not let it snap into hyperextension. And having that control will help you quite a bit. Use your deep external rotators and then your lower abdominals. We don't want to forget our back. It is attached to our hips as well. So if we can connect that to our lower abdominals, we're going to be able to stack the rest of the spine like we talked about previously. So our ear can go over our shoulder, over our hip. Because if we're off here, it's going to change everything else that happens down here. Okay, so with all these muscles connected, you get to raise all the way up. Now this is the next thing that I feel is very important for us to discuss. Overarching. Everyone wants that beautiful, beautiful arch that dancers have, and they stretch it and they try to make it happen, and then they start doing this. Or they're already really flexible and they start doing this. Unfortunately, this is going to put tons of strain in the front of your ankle, maybe on the back of your toes. Some people have issues right here in the front of their toes. But it's also going to change where your weight is going up your body. So you're probably going to be stressing your back. You might be stressing your hips, but you're not going to be absorbing force very well at all. So what I say is stack your tarsals, stack that foot up. If you can line your ankle right over those two front parts of the toe that we're talking about before when I said divide your foot up into 3 parts. Now we divide our foot up in just to the front 2 parts, the first knuckle and the 5th knuckle. And if we can get our ankle right over that, then you'll be able to absorb a lot of force. It'll go straight up your body and it won't collapse in any other part, damaging tissues. And this is an example of rolling in, which we didn't talk about in the previous one. So that's something else that can happen. Maybe we're relevaing and we're not going overarching, but we're actually just going over the first toe, and we're not lifting through the arch like we wanted to when we started our releve. This one, perfect. All our weight is going right over that second toe. Okay, now the jump. I'm just going to read through this, and then we're going to talk about the issues that can happen if we don't do it well. So we're going to start with our demi-plie, releve as described, follow through with a jump, pushing through and articulating through the whole foot while maintaining core engagement. This is really important. If you only do the foot and then your trunk is swaying back and forth, you're not going to have a solid landing, and it might have an ankle sprain. In the air, the weight should pass over the second toe. The trunk should remain upright without arching your back. When returning from the jump, articulate through the foot, keeping the arch lifted and the heel maintaining contact with the ground, keeping the principles of the plie. And we definitely want that arch lifted, and we definitely want that heel to get to the ground. And I'll have some examples of that not happening. Okay, so common mistakes. The arch drops when landing. We can get posterior tendonitis. No one wants that. It's really hard to get rid of, actually. Your knees start turning in. What happens with that? Then you might get patellofemoral pain syndrome, patellar tendonitis, hip impingement, all that sort of stuff. Especially, how many jumps do we do in one dance class? Tons. We have petit allegro, grand allegro. You combine all that together, and then we have 5 dance classes a week. That's a lot of landings. That's a lot of stress on the hips and on the knees and on the ankles. So if we're landing like this every single time, you're eventually something's gonna burn out. One of your structures are gonna burn out, whatever is the weakest, most likely. Anteriorly rotating your pelvis. We briefly talked about that. That's gonna get your back a little bit, and your hips. So we really wanna keep those lower abdominals engaged so we can connect it to the rest of our body. And then the heel's coming off the ground. This is the risk of Achilles tendonitis. So that's pain right in the back of your ankle. Ankle sprains for sure, because we're not grounded. There's less of our body on the ground, so it's easier to roll backwards and create an ankle sprain. And that can take you out of dance for a month to a couple months. Patellar tendonitis and patellofemoral syndrome as well. So knee and anterior knee pain. In the air, we also have to think about our body. We can't just say, yes, we jumped. Fantastic. Let's let that leave. All right. Sickled feet. How do you think we're going to land if our feet are sickled in the air? Not well. We might have an ankle sprain. We're going to land on the outside of our foot. Or maybe we'll overcompensate and land on the inside of our foot and then hurt our knees. Okay. Arch back. Low back pain. Could you imagine just repeatedly jumping like this over and over again? Eventually something's going to give away. And then not maintaining your turnout. It's just a setup for poor landing mechanics. So you want to maintain the muscles that you already started with from your beginnings. When we end, we can land in a really nice plie without hurting ourselves. So here are some examples of good and bad. This, landing without hip and knee and ankle control. What is wrong with this picture? Can someone tell me?
The knees are touched.
The knees are touched, so the knee is going in. Right here, what is the foot doing? It's definitely not turned out, but the arch is completely dropped, collapsed. But that's not surprising because it's a lot of work for the arch to stay up if the knee isn't staying forward, correct? You can try it at home. I believe me, it's hard. This, what do we like about this? What is lined up that we like to line up?
Yes. Knees.
Knee and ankle and hips. Excellent. This is an example of a beautiful jump. Coming out of the jump, what did we do here? We might have sickled in the jump. We landed right on the first toe, and you can definitely tell he either had a knee or an ankle sprain there. He's on the ground. This is a sad picture to watch. Right? Hurts a little bit. But that's an example of what we don't want to happen and why we're being particular about our landing and our plie. Especially our single leg plie, which we didn't really talk about, but a lot of our jumps we are landing on one leg. So it is good to practice. Here, beautiful alignment in the air. Could you imagine that she's going to probably land with a nice, beautiful plie, probably no ankle sprains, knee pain. Everything's turned out, everything's lined up. That's what we want to see. And she actually looks pretty relaxed. There's a little bit of tension in her arms, but. And then over here, this is just a nice plie on one leg that I wanted to show to you. The knee is pointing out over the toe, and the weight is right over that ankle. So another thing I found when people are a little bit weak and they probably don't even realize it, they shift their weight to their toes when they do their single leg plie instead of keeping it over their ankle. So that's some things for you guys to kind of think about. Try to maybe you could go to a crack in the mirror and make a line that's behind you or something and see, okay, is my hip over my ankle while I'm doing the single leg plie? Because if you're shifting to your toes, you're probably not using your glutes, your hamstrings, or your quads very efficiently. Okay. They're kind of grainy. Did it not turn on? Is it because it's from a different computer?
Yeah, kind of.
Oh, that's a bummer.
Yeah. The other ones look well. So I bring those up.
Okay, yeah.
Does this one work first?
Okay, so we need to go to 115.
Mm-hmm. Oh, for that one?
Yeah.
Okay. Boom.
Perfect. Okay. So we are going to watch this girl front. We are looking for the foot and the trunk alignment. What are their trunks doing while they're dancing? How is it affecting their feet? And then the next one we're going to go to is 148.
Oh, it's coming.
They're over there.
It's coming.
Okay. We're going to look up for the arch lift and the trunk alignment. Right there.
Shall we go back?
Yeah. What do we like or not like about this position right here? Anyone have an idea? Nothing. Yep.
She's an arched back.
Yes, her rib cage is popping out quite a bit. What's happening down here at the knee and at the foot? She's rolling in here, and that knee is going in front. So we're not surprised that she's arching at her back because she has to compensate for what's going on at her ankle and at her knee, right? It's pretty hard to stay upright over knees that are super far forward, right? Okay, 253.
I'm gonna go back.
I think this is fine. Oh, it's 248.
That's 253.
Okay. Yes, no, this is single leg landing is what we're watching for. How are they doing with lining up their knees and their backs? Okay, can we go back?
Mm-hmm.
That's a lovely picture. What do we think about this one?
So she's not stuck.
She is tilted. What's happening with the rest of her body? Why do we think she might be tilted? Yeah, she's dumping a little bit into this arch, right? So she's not connecting the arch to the knee. We have to compensate up here. What about this one? How's she doing? Looks great.
Yeah.
Super lined up. If I took that line and drew right through her, it would be perfect. The hip, and this is a beautiful single leg plie as well, where I would take the hip and I'd line it right over the ankle, which is nice and a lifted arch. So that's a great example of what we want and maybe what we don't want, maybe how we can fix it too. Okay, and then the last one is 341. Looking at the exact same thing, single leg control, what's happening?
Do you want me to keep going?
I think this one, you see some wobbly. I think it's that one, yeah.
She's rolling forward.
She's rolling forward, but you know what? She's wobbling in her knee every single time she lands. Can you play that one more time?
Mm-hmm.
So what we're probably not engaging is our deep hip external rotators and our deep core.
Mm-hmm.
And it's actually not the foot's problem. The foot's trying to help, and it can't because the core is not doing this work and the hips aren't doing this work. So everything kind of has to work together. Okay, next one. Or it's actually the last one, this one.
The small jumps.
Small jumps. Okay. This is a nice example of really good control. His heel is coming down every time. He has a nice plie. Everything is nicely aligned. His trunk isn't moving all over the place. He can leave his arms completely relaxed and his head is staying right over the rest of the body. Oh, it's gonna, okay, good. And then the last one, yeah, that one. I included this because it's a lot of beautiful jumps. So I wanted to leave images of correct landings. People getting their heels on the ground, controlling, that's not as controlled, that one. Some balloon, lifting up, see, everything was nice and turned out, connected in the air, so you can land really nicely and then go on to the next jump with lots of control. Is there any stress in their upper body at all? Nope. Yeah. I just wanted to throw that in there so we didn't have to be so picky all the time, but we can also appreciate some beautiful, beautiful positions in dancing as well.
Okay. No, go back. Okay. I'll get Danielle. Okay. Is that you good?
That's it.
Okay. So we're gonna talk real quick, just kind of like rolling on through for just preventing injury, kind of take home message, and then we're gonna do exercises. Some of you guys are gonna participate because we have 10 minutes and it's gonna be really fun. Okay. All right. So preventing injury. The main thing that we kind of wanted to talk about tonight is don't cheat the technique. That's really important. Don't force your turnout. Strengthen those weak muscles and make sure you stretch the ones that are really tight. Remember that dancers are athletes and you have to cross-train as well, in case you don't get those overuse injuries that we talked about in the beginning. Stay hydrated. This is kind of important for just every athlete, but especially our dancers, especially if you're going into long rehearsals or multiple dance classes back to back, is when you go to the bathroom, your urine should be like a light lemonade color and not apple juice. So that's really important. If it's apple juice, it means you could be dehydrated and you need to drink more water. So during intense activity, 8 to 10 ounces every 15 to 20 minutes, and then dehydration is lower by a drop of 1 to 2% can negatively affect your performance. And then eat well, because low energy intake can result in lots of bad stuff. Loss of muscle mass, so then you don't get to be as strong. And then for our young ladies, menstruation dysfunction, loss or failure to gain bone density, which is really important to have really strong bones. And then that increased risk of fatigue or injury. And then you have that prolonged recovery time. So if you don't have all those nutrients in the body, if you are injured, it's going to take you even longer to heal. And then most important, I think, because I like to sleep, is get plenty of sleep. So children aged 6 to 13 should get 9 to 11 hours of sleep. And this is from the National Sleep Foundation. And then ages 14 to 17 should get 8 to 10 hours of sleep. So don't forget, even when you're working so hard on your landings and your jumps and your plies, that you still need to eat, drink water, and get plenty of sleep so you don't get injured. And then we're going to talk about our top exercises. So Heather is going to describe them while I perform them. And I'm going to have you two young ladies come on up and hang out with me. You both have green little bands. If you are at home, you don't have a green band, but you can still practice without them. So green band is in your folder. And then we're going to tilt the videos down so you can see me on the ground for everybody at home. All right, we get to become friends on the ground.
You go, Claire.
Okay, so you're going to put band around your knees. Band around your knees. Can you see me? Yeah. Okay. Boom. Okay.
So you're going to lie on your side.
Hi. Come face me. Your friends. Hey.
And one thing to think about when you're doing this exercise is not letting the pelvis fall inward. You really want to think about keeping the trunk nice and long, almost like you're trying to keep a space underneath here. Okay? Let's have you bring your knees in a little bit closer. There you go. Okay, so engaging the stomach, your core. Okay, think about pulling that belly button towards the back of your spine. You're going to just lift your feet up into the air. Just lift it. There you go. Good. Now you're going to open up that top leg, like you're doing the Claire show, and you'll take the top leg and extend it all the way straight. Good. And then you'll bring it back in, the knees still open, back together, feet down. Okay.
How many times should we do this, Miss Heather?
Well, up to about 20 times on each side would be great. And that way you will really feel it on your side there. When you're
Should we do 3?
Yeah.
Let's do 3, guys.
Okay, so feet up, open up, extend the top leg, bring it back together, knees, feet down. Good. Feet up, open that top leg, extend the top leg, feet back together, knees closed, feet down. Good. Nice job. Yeah. Do you need to do the other side, even out?
I'm okay.
Okay. Okay, so then let's lie on your back. We're going to do the single leg bridge.
Bands on.
Yeah, bands.
Come on. You get to keep those.
All right. Okay, so keeping the knees bent. Again, think about your pelvic placement. Your core is engaged, okay? Neck and shoulders should be nice and relaxed. You're going to go ahead and you're going to bridge up. But as you bridge up, we're going to bring the right leg up to extending it towards the ceiling. Okay, so you're going to inhale, exhale, extend. Good. Now you're going to bring your right leg down towards the floor, not touch, keep it long, and then back up, and then bend the knee and come on down, and then add the bridge. Now the trick with this exercise is as you're doing it, not to let the pelvis drop. Okay, if you're letting your pelvis drop, that means you're not using your hips and your glutes properly, and you're not using your core enough.
For the folks at home, can we see just Caitlin doing it?
Yeah. So go ahead and you're going to bridge up and extend the leg to the ceiling. Then extend the leg down, And see how our pelvis is staying nice and level across here. And then you'll bend the knee, come on down, and bridge down.
Thank you.
Do you want to show a way not to do it? That might be good too. So yeah, so as you come up, so her hips are not level here, and then, yep, or you also don't want to arch too much either. So she wanted to keep engaged here, so she's keeping her ribs and her hips in a nice neutral spine there, and then coming down. Do you want to, I'm sorry, what? Oh. Okay, and then we have the adductor series. Okay, so lying back on your side. I was going to say, Caitlin, so you can see. So again, thinking about your spine, your pelvis is in neutral position. Don't let yourself sag. Really kind of lengthen through that spine. Okay, so the first one is you're going to bend the top leg. Good. And then you're going to lift the bottom leg. Yeah, just lift the bottom leg. Good. And then you're going to extend the leg and then back down. Good. Did you want to add something?
That's fine.
Okay. Yeah, we were kind of trying to. Okay, we'll go ahead and turn and we'll teach you a little bit different.
Okay, there's different ways to do it.
Mm-hmm.
If you bend the top leg and put the toe on by the knee, resting it on the knee, you can create a little resistance, and then you lift the bottom leg up, and then the next one is extending the top leg out, bringing the bottom leg to the top leg.
With keeping a tight tummy.
Yeah, tight tummy, and then lower the bottom leg. Keep the top leg up there, and then bring the bottom leg to the top leg again.
And then you can add a ball in between.
And lift up both legs.
Yeah, to both legs.
With a tight tummy. Excellent. Good. That's okay.
And then the next one, thank you, is swimming. So lying on your stomach. Okay. So this is a really good exercise where you can practice not letting those shoulders rise up towards your ears. Okay. So keeping your the bones back here, our scapula, keeping those engaged so that your shoulders don't go up towards your ears. Even in this position, you still want to think about engaging the core by trying to lift your belly button off the floor, like you're pulling it towards the back of your spine, okay, and reaching long from your hands to your toes. Okay. So on the first one, you can just bring the arms up and the legs up at the same time, keeping the core tight, and then you lower down. So again, just pulling that belly button first and then lifting up. And that's more of a hover. Good, okay. And then the second one, you would alternate the arm and the leg lifting. So you're going to lift your left arm with your right leg, and then your right arm. We're not alternating yet. Just you can build up to that. Sorry, Kim. You can build up to that. You can do one side at a time. So you could just hold. Sometimes it's nice to hold for a good 5 seconds and work on strengthening, and then you can switch sides. Good. And then you would build up to number 4, which is the repeated alternate side to side. So as you're doing this, if you watch Caitlin, she's pulling in her core. She's watching her shoulders so they're not creeping up by her ears. And it's like she's swimming. She's alternating. There you go. Girls, you want to try that one? Good. Okay, so pull in your core and make sure you're breathing. Watch your shoulders. Good. And alternate. Good. Use those glutes.
Got about 4 minutes.
Okay. And come on down. Okay, and then the last one is the mermaid. And so this is sitting in a side sit position. Okay, so maybe we'll just let you demonstrate this one, Caitlin, since
The most flexible one here.
okay.
Rose, can I have you scoot this way a little bit?
Okay. So modified jazz split. Here you're gonna go ahead, you're gonna inhale, and then on the exhale, you're gonna side bend over. Bring your arm overhead, good. And then you'll put your top hand down and rotate and push the foam roller away as you lengthen through the spine. Good. You can even press down into that foam roller just to engage the scapula and pull the roller back as you come back to your side bend. Go first. Good. And then lengthen back out. And then come back out of rotation and back up. Good. Okay, we'll just demonstrate again.
Sure.
You make sure you're breathing. You want to use the inhales and the exhales as you move lengthen. Use the scapula engage.
So your chest.
It feels really good.
Yeah.
Okay, cool. Good. And the next one is our essential foot care. So this is what to keep in your dance bag. And if you are here, then it's in your folder. And if you're at home and you would like one, then we will type in our email address, and then I can email it to you if you would like. So